tulipoanza miaka mitano sasa kushirikiana na CDC.
AFOD means Action for Research and Development. AFOD is a youth based organization that was founded in 2008 with the objective of reaching out to youths in this community of Eastlands. AFOD is at the heart of Kayole and Komorok, where they coordinate most of their activities. AFOD was founded by young, energetic people who are just pursuing their studies at the University of Nairobi. And what made them to come up with this organization was specifically to address the issue of HIV and AIDS, which was becoming a big threat to most of the youths in this Eastland community.
Yes, AFOD being an organization being run by the youth and more so was geared towards sensitization of HIV and AIDS among the youth, has seen quite a tremendous improvement in the youth behavior in the community, because what we have come to realize that an organization being run by the youth is liked by the youth. And I would say that they have captured quite a good number of the youth and they have been sensitized. And when LVCT started funding the organization, we came in to formulate a strategic plan, financial management, and the general management of the office.
We have been able to reach over 60,000 young people, children and parents of adolescents. We provide life skills education, sexual and reproductive health information. We do referral for health services, including STI screening, post-exposure prophylaxis. We also referrals for economic empowerment, and at the same time we also give financial literacy education and entrepreneurship training of youths. Our major challenge is maybe in terms of resources that we have. We have been faced with a number of beneficiaries who need our services in the community. But since we have limited resources, we have not been able to achieve a good number of beneficiaries that as the demand is currently in the community. In terms of delivering our services in HIV/AIDS, there has been a good acceptance for these services, and we see a number of behavior change among these people. And one remarkable improvement we have seen, number of young people going for VCT. Some of them are accessing treatment, and even in terms of number of school dropout, in terms of pregnancies, has been going down. We have worked with youths in Soweto slums, that we have seen such areas of a remarkable improvement. One thing that make these youth vulnerable to HIV infections is as economic determinant. We see them lured by other men into sex. So by also us addressing issues like economic empowerment, we're able to give them opportunities that remove them from vulnerabilities from such issues. We see a number of young people not using condoms. This put them at risk of contracting HIV/AIDS. At the same time, peer influence. We see peer pressure, and we see young people getting into sexual intercourse at early ages because of peer pressure. So by giving them some education on how to protect themselves and giving them, referring them for condoms.
Naitwa Brenda Nyango, niko form 3. I'm in Talagals High School in Machakos County. Okay, I've benefited a lot from the group, from the program, the AFOD. I joined the program in 2011, and yes, to 11 on June, and they have really helped me a lot. I've improved my life. Okay, at their back, I was almost dropping out of school. I was just down, depressed. I was just confused. Okay, yes, I was in a dilemma, but there is a person, the health community worker, who helped me to join the group, and they counseled me. So I gained from them, and I was able to move on after the counseling. I also went through the Healthy Choices Making program. I also benefited again from there. Yes, and right now I can say I'm much better than before right now. Yeah, because I've gained a lot from them. Okay, I like in Healthy Choices. I learned much because first I was taught on abstinence from sex. Secondly, to the benefit of being tested for HIV, and I was told if you can't abstain from sex, we are given the two choices. You can also use the condom, but the best I was told is to abstain.
Since 2010, AFOD has made tremendous achievement in terms of data, in terms of the impact, as far as the programs are concerned, and this has come because of the good team that the program team has had in terms of the capacity level. The program people have undergone different trainings, including for M&D, quality management, monitoring of different programs. They've been training on how to monitor these different interventions, basically the ABIs, evidence-based intervention, and so forth. So this has really enabled the program to have impact as far as delivery is concerned. Without delivery, and then there's nothing you're doing as far as the program is concerned. So the quality of the program has been able to be improved because of the level of understanding of different people implementing this program. Going to the field to be able to see if the kind of are they following the right, are they providing the right material to the right target group? Because if you are giving out wrong information to a wrong target group, then you're not achieving the goal of the program.
What have also worked to our favor is that in schools, like these particular children that majorly in class 5, 6, 4. So there's what we call life skills in school. So when you go to life skills, there's things to do with the self-esteem. When you go to class 6, they talk about the physical, emotional changes that takes place in the body. So these things are not new to them. So I think that have bridged the gap. So it has not been hard working with them because they also learn life skills in school. So Family Smarter program basically target the parents that we are talking about, the parents and caregivers like teachers of children between the age of 9 to 12.
Majina yangu ni Fanny Sinekesa. Mimi naishi Kayole mahali inaitwa Nyando. Na kukuja kuchua AFOD nilichua through mama mwingine rafiki yangu mwenye alikuwa amesoma kuhusu familia inafaa. Na akanialika na mimi nikaenda nikaisoma. Imenisaidia sana kwa sababu mimi nilikuwa ule msasi mwenye hata hajielewi. Sasa ile mtoto wangu ananikosea tu na stukia tu nimemchapa. Na hata hana makosa nimemchapa. Lakini wakati nilienda hii mafundisho nilipata njia ya kuweza kumuongelesha mtoto na nimeona hata change. Mambo ya ngono kwanza nilikuwa na aibu sana nayo. Nilikuwa nikisikia tu hata kutaja tu china ngono naona kama ni dhambi. Lakini wakati nilienda hii mafundisho nilipata, tunafundishwa kuhusu hiyo ngono. Vile unafaa kuelezea mtoto wako kuna ugonjwa, kuna nini na nini na nini. Hapo nikafunguka macho na nikaona hata mtoto wangu sasa ni mwepesi wa kuongea kitu kama hiyo. Lakini wakati nilikuwa sijafundishwa hii nilikuwa naona aibu sana. Siwezi tamka kitu kama hiyo mbele ya watoto.
When we started, we were only 3 volunteers. And during those times, our systems and structures were weak. The staff said no contracts, and never did we do annual returns. We had an HR manual, but it was non-functional by then. We also had an organogram, that is the structure organization, which did not reflect who we really were by that time. Yes, so we've witnessed a lot of change during Ungana program, where we partnered with the LVCT Health in the year 2009 March. Up to now, they've taken us through system strengthening workshops, which has strengthened us in terms of governance, programmatic, finance, and legal issues. And through the capacity building, we've trained several staffs, which are now implementing several interventions. Like we have 20 staffs trained as volunteers in several programs. And we now have 9 permanent employees who work on annual basis.
When we carried out our assessments in 2010, the beginning of 2010, we saw a lot of potential. Because these were young people who showed a lot of promise, were very vibrant, and they seemed to really know where they were going. AFOD, we have walked this journey with them for 5 years. And I think one of the things that I can say about AFOD is that they have diversified. They were able to take on board some of the evidence-based interventions.
We want to expand our services to reach beyond Embakasi. That's one thing. As well as we wanted to expand some of the activities that we not be able to do because of limited resources. We want to maximize our financial base by doing resource mobilization and initiating some income generating activities that are able to expand our financial base. We have developed a sustainability plan, and in that plan we are intended to initiate some income generating activities, and some of them already we have initiated, like pool tables, playstations. We also want to venture into resource mobilization from the community in terms of organizing football for fundraising, organizing golf tournament in November, as well as to maximizing our fundraising from donors.
Brought us together under the umbrella. We stand together and fight against this disease. Ungana, simama, pamoja, kwa umoja, Ungana, pamoja, we stand together and fight against HIV. Ungana.